welcome everybody to our webinar, Digital Healthcare, Building a Healthy Ecosystem. I'm absolutely delighted to be joined by such an exceptional panel. We have Baiju Thakkar, CEO of Dr. Care Anywhere. We have Charlie Steele, CFO of Babylon Health. We have Hugo Stevenson, Group Executive Director and co-founder of Induction Healthcare, and Tim Barker, CEO of Kooth. And before we start, I'm going to ask each of our panelists in turn to tell us what they think makes a healthy ecosystem. So Baiju, would you start, please?
Lucky me first. So what makes a healthy ecosystem? I mean, it's always difficult as a recovering doctor to answer that question because I have lots of biases, but I think it is one that generally and genuinely meets the needs of all the key stakeholders. And the key stakeholders in healthcare are obviously patients, clinicians, and payers. And you need to meet those needs in a way that is equitable. And that is key for a healthy ecosystem. Do you genuinely meet the needs of all those three key stakeholders in a fair way? Do patients feel they are kept well? Do they feel they are looked after when they need healthcare? Do they feel that they are cared for? Do they feel that it's personalized to them? I guess, do clinicians feel they are able to do what they want to do? It's one of my biggest frustrations as a doctor was we couldn't really do what we wanted to do. We couldn't really spend the time with our patients. So can we do what we really want to do? Can we do it in the best way we can? And do payers see value for money? Do they see the clinical outcomes they want? So a healthy ecosystem for me are really those three things, Rachel, which is, satisfy the patient, satisfy the clinician, satisfy the payer, and then you will have a healthy ecosystem, which we don't do well today.
Great, that's extremely clear. And I look forward to discussing that further on. Charlie, how about you?
So I completely support those comments. I think that's exactly correct. And sort of one of the ways we think about this at Babylon really is mixing affordability, accessibility, and clinical quality together. And really sort of when you have high levels of all three of those things, you end up with a very healthy ecosystem, because it basically goes back to exactly the point of managing the stakeholders' needs and wishes and making sure that you're delivering that in an equitable way. So I think sort of what you see in various countries is that those three things don't mingle particularly well. So in the UK, for example, we've got very high levels of clinical quality. Affordability is also very good because effectively it's provided by the taxpayer. But accessibility is not so great in many cases, and at the end of the day, that's the reason why we ration healthcare. If you take the US, you've got a very different system where, for example, you've got high levels of clinical quality and accessibility, but affordability is very low. So I think sort of if we also think about how we can create a healthy ecosystem by improving those three levers, I think you'll incrementally get a much better ecosystem as a result at the end.
Thank you very much. Hugo, what's your perspective from the other hemisphere?
So I might take a slightly different tack, and if I begin by just looking at say a national geographic definition of an ecosystem. So an ecosystem is a geographic area where plants, animals, and other organisms, as well as weather and landscapes, work together to form a bubble of life. So the key to me there is the bubble of life that gets formed. And so my definition of a healthy ecosystem, kind of borrowing on that, is a virtual area where community members, and so I emphasize not just patients, but non-patients. So these are people that might become patients one day, but today might be completely well. Doctors, nurses, allied health and complementary health practitioners, but also pharmaceuticals, medical devices, very big, it's a very big catchment, work together to form a bubble of improved health and well-being. And, the key, the corollary there for me is the bubble of improved health and well-being in the same way as a bubble of life. At Induction, we realised that the healthcare systems we have today around the world are big and disconnected. They don't really operate like a healthcare ecosystem, but they are big health systems and a big drain on the public purse and on private funding. And so we try to provide the tools, the digital tools that actually allow the healthcare systems that we have today to operate more as an ecosystem and more about producing that bubble of improved health and well-being.
I like that phrase, the bubble of improved health and well-being. Thank you, Hugo. Tim, over to you.
So maybe just to build on the other speakers, as you know, in the UK and in fact globally, healthcare systems are full, right? We're full of waiting lists. And projections are that's going to get worse. So when we look at the role that digital can uniquely play across all of this, of course, it can drive efficiency, data sharing to enable organizations, that are providing healthcare to operate more effectively. But I do feel one of the big opportunities we've got with building a digital ecosystem is to move healthcare further upstream, to focus on early intervention and prevention. We all carry supercomputers in our hands. Our steps are measured, our biometrics are increasingly measured. And those little nudges that can help you focus on healthcare as opposed to sick care, I think globally is a hugely unexplored area, because the pressures on healthcare systems have really forced them to primarily focus on acute care. So for me, a healthy ecosystem is one that can apply the best of digital, which is to provide personalized care for the individual. So we are focused on individuals, not institutions, and enable us to remain healthy and stay out of primary and secondary care.
Thank you. Very interesting collection of thoughts. What would you say is the type of ecosystem that the current market can best support? Who would like to come in on that? Beju, you have thoughts on this.
Yeah, happy to. I think ultimately for healthcare to improve, and that's what we're all really here for, how do you make healthcare better? You need a genuine alignment of incentives between those stakeholders that I mentioned. So if have we really aligned incentives between the patient, the clinician, and the payer? And think about how do you use technology to make things genuinely transparent? That's actually what digital technology is doing. It is making things transparent. It is collecting real world evidence. It is putting it in the cloud, and it's providing evidence for both clinician and patient to make things transparent. And that's what allows you to align incentives, where the power and the asymmetry in healthcare, there's massive asymmetry in healthcare. There was, I practiced medicine for years, massive asymmetry. And how do you change that? How do you align incentives is really through transparency. So shift that power to the patient through technology, shift it to new funding models because you have the information. And I think that is what really will make the market work and make where we can think about, and I'm sure we'll discuss how one makes money in this space.
Tim, would you like to comment on that?
Yeah, sure. So when you think about the type of ecosystem that the market can support, I mean, in the last few years, we saw initiatives like NHSX really trying to drive and build an ecosystem of entrepreneurs and organizations that could really all lend a hand to the growing demand and need that there is. So when you think about what the market could support, there's probably two sides of this. There's a supply side and a demand side for it. Right now, this entire market is going through a blitz scaling phase where VCs are throwing incredible amounts of money into basically identifying the future winners of this market. However, I think probably based on the scale of this market is going to be a market of niches that we're going to end up. There is not going to be a one size, one shot solution to this. I think the thing that will shake out as part of this, what the market can support is there's a lot of early startups coming into this, and especially in the market space that I'm in, which is mental health, right? Where essentially there is a broad spectrum of what seems to be treatments that might start with meditation and end up with cognitive behavioral therapy. I think the market is going to be looking at, is going to need to support an evidence-based ecosystem, because ultimately that's what gets alignment, as Beju says, between that. And that's really where you get an alignment of incentives about driving outcomes, a lowering more economic unit cost of value to healthcare providers, insurers, and patients.
So do you, Hugo, I mean, do you think that there are potentially too many players in this market?
Look, I think one of the big challenges in healthcare today, and it's how we've built up this system over the last couple of 100 years, is in order to have a healthy ecosystem, and it speaks to the points of Tim and Baiju, how do you remove like a sense of competitiveness and silos from the healthcare system? And you know, it really, you know, whether you look at kind of sick patients versus healthy patients, gee, the sick patients are consuming all the resources. There's an inherent competition in that. You know, primary care, gee, the primary care is responsible for holding this bucket of money, you know, and then all of a sudden secondary care sits in competition to that. Well, what about alternative care versus traditional medical care? Like, we acknowledge that there's a place for everybody, and yet there's a sense of competitiveness and siloedness to it. And look, if I'm honest, I think this is one of the challenges that hasn't been solved and needs to be solved for things to become successful, is how do you remove friction where, you know, a new entrant into the market is not considered as a competitor, you know, where there is a, you know, a sense of, all of a sudden, you know, my patient wants to go and see an acupuncturist. As a doctor, I'm prepared to support that. How do you kind of give things a go and manage to make things go forward rather than putting up blockers all the time? And healthcare is full of blockers at all levels.
Unfortunately, it absolutely is. And I think this goes back to Baiju's point at the beginning about stakeholders. You know, actually, how do you give the patient the best care possible without getting drawn into these issues of competition?
And if I may, just for 1 second, one of the challenges is also, how do you remove the pressure from anyone in any place in the system to kind of be the savior, right? So you turn around and go, well, gee, if we actually allowed nurses to prescribe, does that detract from doctors and their ability to be the savior? If you allow companies to actually generate a solution, does government stop being the savior of the people? You know, or like, so there's this inherent, you know, competition as to who's actually providing the solution, you know, to all of this. Are there governments, health departments that would be prepared to actually see a non-government solution become successful, because that means letting go? You know, and, you know, even if you look, for example, at space and SpaceX, you know, there is that tension that exists in the space world. You know, are you comfortable letting a private solution continue? But I think the dynamics in healthcare are even more complex, and that's something that we do need to overcome.
I'd love to hop in on that, because Hugo, I totally agree. I mean, I'm sure Tim and Charlie will have a view on this, but a really strong Secretary of State, when you think about healthcare and public health, would be someone who said, I'm going to make all hospitals redundant. Not, I'm going to build more hospitals. I'm going to make all clinicians redundant because I'm going to keep my population well. We don't see that in any country, right? Real leadership in this space and using technology would be someone say, I'm going to keep the population well. We don't need our health system. So I'm sure that may not be music to anyone's ears in the short term, but it should be what real leadership looks like in this space. And Hugo, I totally agree with what you're saying.
And I think exactly to that point, right? Like, sort of 85% of all expenditure is basically spent on the last 2 years of people's lives in sick care. Will that ever go away though if you make people healthier? I'm not so sure about that. But at the same time though, at least you can improve outcomes hugely by focusing on keeping people healthy, exactly as you say, Baiju. And I think that has been the problem, is that you've got an escalating 6% cost every single year in real terms. It's just not sustainable, and there has to be something at the end of the day that's going to change that. You can't just have longer and longer waiting lists. You can't spend more and more money. And really, the only other sort of avenue to go down is this healthiness avenue, and really sort of incentivizing people throughout the system to keep people healthy, whereas at the moment just those incentives aren't really there.
I just want to remind everybody who's watching to, if you do have any questions for the panel, please do post them in the Q&A and we will get onto them as soon as we can. I mean, one thing that's coming out of this for me is, you know, can the public system, the NHS, for example, over here in the UK, and private companies really work effectively together in an ecosystem, or are they actually binary opposites that will forever have this sense of competition and can never work in a healthy ecosystem. Hugo.
So when I was a kid, I used to play, word games where you'd take, say, a 4-letter word like farm, and you'd have to turn it into duck, and you could change one letter at a time, and it had to be a real word to get through. And so there's a series of stages that have to be viable. And I think kind of there is the future version of healthcare in, where we might say in 25 years' time. And there's the healthcare that we've got today. And how can we continue to change that system stepwise in a way that still functions along the way? I think just for the benefit of investors that are actually watching this, though, it's a little bit like turning around and saying, well, today we live in a digital commerce environment where everybody's connected to the internet. Everybody's got a website. Everyone banks electronically. We're all sending emails. And if anything, we're kind of a slave to the emails that are coming in and playing, tennis with the emails that come through the door. But if you imagine where the world was 25 years ago, where companies didn't have any email, where, you give a business card to people all of the time, and you said, okay, one day the world is going to look like this. There are a few things that kind of had to happen along the way. And there was a digitization of business that had to occur. Everyone had to get an email at one point and start sending it. Everybody had to get a browser, and, we needed Mosaic and so on. And I think we're still at the early stages of that in healthcare. I can imagine a world exactly like Baiju says in 25 or 50 years where we might work towards a healthcare ecosystem that sees the traditional doctor become an anachronism, right? But at the same point in time, the first step along that way is to get everybody digitized, all elements of the healthcare system digitized, getting those things to work together. And I think if we start seeing this evolution in stages and go, how do we actually make those steps incrementally, we can see from an investor's point of view where that future, lies and how you can actually help it become.
Maybe just to add to that, I'm sure you all seen the news recently that NHSX, which was the sort of the tech accelerator, and NHS Digital are now being folded into NHS England. So to your point, Hugo, I remember in the UK, we innovated, we pioneered in healthcare when the NHS was created. What an incredible opportunity we've got now to go through building the digital infrastructure inside the NHS, which I'm feeling more confident about seeing now these things being folded into NHS England, and then to provide that digital baseline that we can then basically build an ecosystem of innovators around. These problems are too big for any one organisation to tackle. By the time a problem hits the NHS, you missed 10 opportunities to tackle it earlier. Tackle it when it's a £1 problem as opposed to a £1,000 problem. And what a great place it would be if the UK could be this innovation hub, and especially in public health and early intervention, because our healthcare system is built for that. With the reorganization of the NHS around integrated care systems, ICS's own whole population health, primary and secondary. So the tectorial plates around what it would take to build this sort of digital foundation and an ecosystem are perhaps closer within reach in the UK than in almost any other healthcare system. Compare that to the US, where there is a huge amount of structural headwinds and economic headwinds around making large structural change. And I just wonder whether, we might be looking for an ecosystem that actually is closer to us in the UK than it might be in other parts of the country because of our unified healthcare.
That's interesting, but I mean, picking up on this point of actually, do we need substantive system change, or do we just need to digitize the system? So in other words, are we currently just digitizing an analog system, or is there the appetite to truly reinvent the system for a digital world? Who would like to comment on that?
I think Charlie. on that there definitely is. I think the problem is that it's so big to do it as a sort of single overhaul, And look, like the government tried to do it back in the early 2000s with the NHS Digitalisation contract, which basically didn't work, right? And it's just such a massive challenge. But I think also the other problem as well, though, is that we need to get away from the narrative of private companies doing things in the NHS as somehow like privatizing the NHS. And until that narrative goes away, you'll always see these innovators sitting on the fringes of the NHS rather than being fully integrated in with it, because there's just basically a level at which the integration goes too far.
Hugo's got his hand up. Hugo and then Beju.
I think we are still in that early day of digitization, to be honest. If you actually just sit anywhere within the healthcare system, and I don't mean when you're just seeing a doctor in primary care or secondary care, but when you're being tended to by a nurse, when you're discussing something with a dietitian, we're still primarily in a face-to-face, physical delivery care model. And there are some challenges in healthcare whereby, this idea of you don't want always direct access between a patient and a doctor or the healthcare system so they can be demanding care and so on. There need to be some gatekeepers in the process, and that's been how healthcare has been built up. But I do believe, good or bad, if you look at social media, it's a good analog, right? The way that we discourse as a community through social media has changed. But the first step in that journey was digitization of each individual. Everyone got a phone, people joined Twitter, people became on Facebook because they wanted to see what happened to their friends. And before you know it, you've got this ecosystem that's now being able to evolve much more rapidly, but in an uncontrolled way, right? That's the reality of how things transform. And I do believe that as we see more and more digitization of the entire ecosystem, so that's well patients as well as sick patients being connected to this ecosystem, providers and so on, the next phase after this will actually be a reorganization of the system, but it will reorganize from within in ways that we can't necessarily foresee today.
Very true.
So I agree with what Hugo was saying. I agree, particularly, I think, Charlie, what you were saying is absolutely spot on. I think we need to ask the question, why are we bothering? Why are we digitizing? What does that mean? And all of us are involved in digitizing to improve access, but it also has a lot to do with efficiency, has a lot to do with effectiveness, and has a lot to do with transparency. And I used this word before. What digitization really does in healthcare is that it provides transparency in the whole entire pathway and provides us actual real world evidence to say, this is what treatment you need to provide, this is the intervention you need to provide, or this is the public health intervention you need to provide. And it's key. So when people talk about, should we be digitizing? Is that right thing to do? Well, if we don't do it, we're entirely clouded from what's actually going on in the health system. Right? I mean, we should be ashamed of that in the 21st century, that it is hidden from us as individuals, and that's not good enough. There are some people on this call, and actually, Charlie in Babylon actually went out early on and said, we're going to make a change, we're going to make a difference, which has opened up a lot of the market for the rest of us to actually make things transparent. And that's the problem I have, that we're trying to solve, I think.
Yeah.
But look at the backlash in the process, right? It's not as though everybody's behind sort of making those changes. And at the end of the day, the Babylon patient population is healthier than similar cohorts, right? And I think it's important that people ask themselves why. Maybe we're lucky, right? But if you look across similar cohorts, similar age groups, similar conditions, the Babylon population is healthier. And why is that?
I'd like to pick up on the point that we talked about a bit earlier about the number of players in the market and this sort of exponential increase in organizations joining in with digital healthcare. Because do we need to consolidate the market? And if we do, will consolidation of the market increase or decrease value? Tim?
Well, I think that just the standard economics of venture capital are part of the answer here. For every 10 investments, 4 of them will flame out. There'll be zeros. 2 or 3 will get a 3x, 1 or 2, a few will get a 10x return on that. So the investment that's going in is completely unsustainable. You've got in my market segment in mental health care, $3.1 billion has gone in this year up to the end of Q3. That's more than doubled from 2019. And I think you go back 10 years and it was 190 million that was invested. So clearly the last 18 months has not gone unnoticed. It's like we're having the moment that fintech had 3 or 4 years ago, when suddenly everyone could compete with an incumbent as part of it. I think the question is, though, and it really goes to that theme of, are you going to be a disruptor, or are you going to be additive to an ecosystem that's already there? Take it as a compliment, Charlie. Babylon definitely came in with a disruptive viewpoint as part of that. Kooth spent 15 years working with NHS commissioners to really help them on a journey for evolving how digital mental health care could be provided. Now, we don't have 15, we can't wait another 15 years to really get to where we want to be. So I think there is sort of a speed of production, which the startup world can do, and there's a speed of consumption the rest of the ecosystem can do. And I mean, I think we probably, I don't want to speak for everyone else, but there is going to be a large shakeout on this. There always is in these large hyper-growth markets in the next 3 to 5 years. The downside of that is that then puts a small number of organizations that have achieved massive scale, it pushes them into the one-stop shops of the world. And typically in all markets, best of breed is a better outcome than one-stop shops, because all you're getting is in the economy of an integrated invoice in those worlds versus a market of specialists.
The only thing I'd say to you on that, though, is that engagement's really, really important in the digital world. And engagement, if you don't have scale, is extremely hard. So the advantage of the one-stop shop is that you do have people going through that common funnel, and therefore it's easier to send them to the right place. Whereas I don't know, there are probably sort of a few hundred mental health apps out there. It's very hard to know which one's the good one. Whereas sort of when you've got, I don't know, Google Maps and Apple Maps as your only two choice, it makes life a lot easier.
Yeah. Well, to add to that, we certainly see a large number of academic innovations coming out where they've built a great body of evidence, they've got a great therapy, and they've got no commercial side to their organization. And you may see it as well. Maybe there is a future app store model where you can plug distribution in with real innovative therapies. But those innovative therapies are probably the ones not getting 20, 50 million VC funding to try and go hell for leather to really tackle that. So I do feel like in that kind of academic world, like, there is a huge amount of innovation going on, which is not yet commercialized. So I would agree with you, Charlie. If you've got distribution, it's a great opportunity to plug in and help build a best of breed offer therapies that have got a strong evidence base.
Interesting. Beju and then Hugo, and then I want to go to some of the questions that the audience is posing. So Beju.
I'm just going to add to that. I mean, if you look at Lord Darcy's work when he thought about reconfiguring stroke pathways in London, ultimately this was the basis for the fact that if you don't have scale, you're not going to improve clinical outcomes. So when you talk about consolidation, you need consolidation in healthcare, right? You need clinicians to be doing a lot of a single activity to drive the best result. It is underpinned by all the evidence base you could look at. That no one wants to go and have their hip operated on by someone who's just done it once. You want someone who's done it 1,000 times. It's the same with any form of patient or clinician. We need scale in this space. We need consolidation in this space, because that's what's going to drive the best clinical outcomes.
Thank you. Hugo.
So if I may, I'll support the others in saying scale is critical, and we've certainly seen that over the last sort of 12-18 months at Induction. So our Attend Anywhere platform that underpins most of the secondary care telehealth has seen the benefit of a primary care physician being able to be looped into a call at a hospital and so on. So having as many people on similar or at least compatible platforms is critical. But the other analog that I would actually look at, and it's an industry that I was involved with before coming back to healthcare with Induction, was actually drug development and transformation of drug development in pharmaceuticals. So for a long time, pharmaceutical companies used to actually run their own clinical trials and have their own staff in-house and their own software that they built for their own kind of trials in order to manage them, their own business processes. Then there came a world where you had CROs, contract research organizations, that would kind of you could outsource the work to. And then the model that we sort of have found ourselves in at the end is one where there are actually digital services that provide digital tools to contract research organizations. So that provides one common digital ecosystem, and those contract research organizations provide outsourced services to the consumer, being the pharmaceutical company. And there is part of me, if you look at what we do at Induction, that believes in just providing picks and shovels to the people that are actually going to dig for gold. There are companies that are going to have, take quite innovative approaches towards delivery of care, or, providers on the other end of it. They will consume digital tools that don't have to be that different from, somebody in another, wearing a completely different hat. But, some of those therapies will be extremely, successful. Some of those interventions with well patients will be extremely successful. And that will be like mining for gold. Those people will, find gold, and it'll be amazing. And then there'll be another layer that provides the picks and shovels to the miners that are, digging in this system. And that's the kind of business that we're building.
Interesting. Thank you. I'd like to go now to a couple of questions that have been posed by attendees of the webinar. And there are two very linked issues regarding digital access and digital exclusion. So we have talked a lot about equity, and we've made the assumption that everybody is using digital and everybody has access to digital. But actually, how do we in digital healthcare deal with the issues of digital exclusion and increasing access for everyone? Who would like to?
I can take a kick off with this. There's a perception that there's a lot less digital access than there actually is to start with. For example, we serve 3 million people in Rwanda who are, and we do that digitally, right? And part of the way you can do that is by using SMS message, for example, rather than having to have smartphones. But you can also access, for example, computers in libraries and that kind of thing, and also borrow friends' equipment. I think what could start to create more digital exclusion going forwards is where you might have things like wearables that are quite expensive, really starting to drive healthiness in particular, and that you could then start to see a bit more digital exclusion. But at the same time, though, I think that payers have a lot of incentives actually to provide a lot of the equipment to people if they keep them healthier and therefore cut costs. And you see that already in the US, for example, where with Medicare, for example, they provide a lot of free dental stuff, or provide Apple Watches, for example, the insurers do to some of their populations. You see that with actually Vitality Health here, right? That gives you free stuff if you do stuff. And I think really like that is one way we can start to think about bridging that gap, is that when you've got something that is clearly a value driver in excess of the cost of the thing that's being provided, it's worth giving that away for free.
And do you think that's something that organizations like yourselves would do?
Completely. So for example, where we hold the patient budget, if we think that we can cut the patient cut costs by say $1,000 from someone wearing a wearable every day and having more access to their heart condition, for example, absolutely, it's in everyone's interest to do that.
Absolutely. Tim?
I want to touch on another side of digital exclusion, which might be perhaps minority communities that might not feel comfortable with going to seek help in the current healthcare systems that there are, rather than talk about the infrastructure of access to digital. And it's something we spend a lot of time, in our business thinking about when building our service. Of course, our service doesn't need an app, right? You don't need to download your smartphone. You can access it over an internet device. But actually, by making it an anonymous by design service, you can also provide a stigma-free space for people to get help. Right? So what we see now is in London, 50% of people that use Kooth are Black, Asian, minority, ethnic. That over-indexes significantly on the local population. So I think there is, in addition to us thinking at the negative of what we might lose by providing a digital service, think of what we might gain if we can design it in a way that is really co-designed for specific communities and provides them with a safe space to get the support that they want.
I think that's a hugely important point, this idea of a safe space, that the anonymization of a space where you don't have to commit to a face-to-face interaction is really, really important. Hugo.
I think the other thing which I'd add to is that there are key elements of healthcare that will never be delivered, at least in my lifetime, digitally, like surgery and so on. There is a need for non-digital intervention. But what digital does allow is it actually frees up resources for those areas that do actually benefit from a face-to-face or a non-digital interaction. And today, if you just sit in a waiting area, looking at the number of people that are sitting on their mobile phones, waiting and, checking the news or so on, imagine if the people that could have had that consult actually were able to do it digitally and remotely, how many people would be left in that waiting area that wouldn't have to be fighting for parking, that wouldn't have to be, fighting for a chair, even though they might be disabled? And does that free up some of the physical resources for the patients that actually need it the most?
Yeah. I'd like to talk a little bit now about the sort of localization, globalization debate, particularly as we have somebody here who is not in the UK. And particularly around issues like data sharing, privacy, and so on. What do you see as the opportunities and the key challenges for the market in this area? Charlie.
So I think, look, there's a huge opportunity here, but there's a huge challenge. Like the healthcare data is pretty much the only data that is localized and can't be transported across borders, which in reality makes no sense, right? So, like, for example, in Europe, you've got to have a different hosting server in every single country you operate in, which is hugely costly. It doesn't allow you to scale, and just creates a load of other problems at the same time, because you then got to have different privacy policies across different countries and everything else. If you think about everything else, so bank accounts and all that information, completely transportable across borders. And I think when you get to a stage where healthcare data can freely transport across borders, and also anonymized data can be shared a little bit more as well than it is already, huge opportunity, particularly for new startups, to use some of this data, the anonymized data, to create amazing products, right? And I think in some ways, a bit of a shame that the NHS stopped the automatic data sharing that was proposed previously. Understand why, but at the same time, that the opportunity with what you can do with that data is absolutely massive.
Agreed. Hugo.
So I can only really speak to our experience here. I think there are substantial differences in healthcare culture between countries that result in, if you're providing a service that is both digital and the provider, so you're actually providing the full digitized healthcare service, there are fairly substantive tweaks that need to be made, around not just privacy, but payers. Every country has got a kind of different payer culture and challenges associated with that, and different structural problems. But if you go one level beneath that and say, okay, when you're providing the picks and shovels, the challenges that are faced in each market are actually very, very similar. It's just the customers are sometimes slightly different, and how they choose to use those digital tools is slightly different. But we've, certainly seen that the tools that we've successfully deployed across, the British Isles, be used successfully, from Wales to Scotland to England to the Republic of Ireland, but equally successfully used in Australia, New Zealand, Canada, other Commonwealth markets. What we've done is ensure that that technical infrastructure is essentially duplicated in each country. So it's the same infrastructure, but we get around the issues of data privacy and movement and so on, by ensuring a parallel, deployment in each country that meets, the technical needs. but it's underlyingly the same picks and shovels in each market. And we're even starting to see that in the US as well too. It's just how people choose to use those digital tools and apply them to the needs of that market that appears to be different.
Interesting. Beju, from a Doctor Care Anywhere point of view, given that you have anywhere in your title, how do you do this?
It's very true. Yeah, I mean, we're based in the UK, Australia now, Ireland, and pan Europe through various insurers. I think that ultimately, if the patient holds their patient record and that patient record is coded in a certain way, it should be configurable in whichever market you're in. The issue is really around, for me, local registration and reciprocal professional licenses with how doctors behave, practice management systems, local electronic health records, local billing, and local prescriptions. You're always going to have to customize and localize within whichever ecosystem you're in, always. But to Hugo's point, there are some things that are just, frankly, universal. So there is a shortage of supply of good clinicians relative to demand. There is, in every market, is fragmented. We split primary care, secondary care, tertiary care. They are fragmented. How do you use technology to join those up? And data is not joined up within those things. So whichever market you're in, those three problems exist. What is different is the business model and how you think about the local context of communication, engagement, integration, all those sorts of things, which is fundamentally, I think everyone here actually, is doing things in different countries. It's taking a quality healthcare service that everyone is doing on this panel and saying, okay, we'll meet the local ecosystem, but they're all saying, what are those big problems we need to solve? We recognize that there is a shortage of high quality workforce fundamentally in healthcare. We recognize that the system is fragmented and it costs too much money, and we need data to drive improvements in that ecosystem.
Tim.
Yeah, I think you can probably see a key theme coming across this, which is to look at the continuum of spectrum of whether you're going to provide a localized service in a region, in which case you are going to be integrating, you are going to be working with local registrations and regulations, or you're going to be the picks and shovels provider, because when you get down to a patient, it's the same across markets. And it's really just that wrapping around that, the payer model, for example, is the key thing. And we've seen that. And I think, it'd be interesting to hear from Charlie at Babylon about how they do it. Because of that, we've got a bifurcated model. We've got a go-to-market model in some markets where we are going to operate at full service, and then we'll make our technology available in other ones so that we can work with incumbents that could operate that in their locality. And of course, over the last 18 months, 20 months, we've all been Zoomified, right? Every healthcare system has been digitalized in some way. So there's also a huge appetite from what we see of organizations, healthcare organizations, to try and understand what a digitally native solution could be. And I think our opportunity here is to work with them, not to disrupt them, but to work with those local incumbents to help them and bridge that technology divide, and then to enable it to localize it for their local population.
Charlie.
Just one thing I'd say though is that the localization can be quite complex, right? Because not only do you have to have different epi models and different product stuff, different compliance stuff, different languages, it's only worth doing it if you can do it at scale. And I think sort of that's another thing that harmonization of a lot of healthcare compliance stuff would also be extremely helpful. So again, you look across the EU, right? Like healthcare service delivery is probably one of the last things where you have where you don't have commonality of say licensing, right? Like even in the UK, a doctor in Scotland has a different license to a doctor in England. It's totally nuts. And until that starts to happen as well, like it'll be very, very hard to create these products at scale. Like we do it in Southeast Asia.
And Charlie, what's worse is their licenses, the scope of the licenses are different.
Yeah. So
it's mad. It's absolutely mad.
It's absolutely mad. Like, why, for example, if I want to be able to do a consultation at 4 o'clock in the morning, why can you not see a doctor in the US, right? Like, who, by the way, are also really good. It doesn't make any sense, but you can't do that. And by the way, no country allows you to do that either. So until sort of, frankly, the regulations change, I think a lot of the service delivery in healthcare is going to be very, very difficult.
I think that's an interesting point, because we haven't mentioned regulation to date, and clearly where we're talking about cross borders and about systems per se, doesn't matter how well you digitize something, if the regulatory system does not support it, it's not going to happen. And I'd like us now to turn to the, I will come to you. Well, Hugo, yes, do make your point.
Oh, no, just very quickly, I was going to say, I think regulation follows the pre-existing momentum. Regulators feel much more comfortable to change things when that change is kind of inevitable and market driven. But I'd say the other thing which I would observe is that many of our clients, which are healthcare systems, don't purchase solutions because interoperability is top of mind for them. They're purchasing a solution because they've got a very, very specific in the weeds problem. And what we then deliver, and other companies in this space deliver as well too, is, oh, well, by the way, you actually bought interoperability as part of what you had. So, you know, if I give an example, you know, we've got a platform called Switch, which helps doctors communicate with each other. And it's used by pretty much every junior doctor in the secondary healthcare system in the UK. They don't download it because they want interoperability between hospitals. They download it because they want to access bleeps and phone numbers and take shortcuts, essentially, you know, in their day-to-day care. And surprisingly, everyone's on the same platform and you can now actually intercommunicate. But that's actually an added benefit. It's not the primary reason why customers or providers or even patients, you know, choose to participate in the system. It's an added benefit that flows downstream. But regulation then follows that, because once people are actually interoperating, it's easier to actually allow that to continue than it is to, you know, to turn around and maintain blockers.
Absolutely, once you've got a cohort of people who are using it and are happy. So what I'd like us to spend the last few minutes looking at is to think a bit more about the future. And I'd like to go to one of the questions from our audience. What do you expect the landscape for digital healthcare providers to look like in 5 years' time? Who would like to pick that up? Charlie?
I can kick that off. I think what we'll see is a lot more specialty care and use of skills mix. So you won't see everyone getting funneled necessarily through a GP first. Like what we find is that you actually only need a GP about 40% of the time. You can use prescribing pharmacists, behavioral health specialists, nurses, like lots of other great people who actually will have those specialities and deliver that to patients much more effective than a GP will. So I think what you might start to see is actually the traditional GP, being a general practitioner, will actually start to erode a little bit. And the reason you can do that, again, is because you've got the scale. If you think about, if you've got one GP practice in a small town or large village, for example, the person does have to be a generalist. If you've got access to a healthcare professional from anywhere in the country, you can have a particular behavioral health specialist, for example, who just does the consultations that way. So I think that's really sort of where you might start to see it going in sort of 5 to 10 years' time.
Interesting. Beju.
Yeah, I agree with that. I think you'll see, I mean, to this point again, when more complex care needs to be centralized at scale, the evidence base is clear about that, as I mentioned before. I think you will see in digital healthcare, if we look at the problems that need to be solved in healthcare, we need to deal with the fact that we don't have enough supply to match demand. And so how are people using digital tools to optimize the workforce, both time and, as Charlie described, the different type of workforce? How are people using digital tools to improve the way people move through the journey? And fundamentally, as we see a number of companies who are thinking about digital therapeutics, how are we using technology to actually improve diagnostics and intervention that drive down costs and improve outcomes? And this is, it's in a hugely exciting area. But without the data that underpins it, it's not an industry that will move fast without it. So the collection of the data that you can prove to the industry that this is better, this is clinically efficacious, and it's proven through trials is going to be key. But I think the digital ecosystem is really in healthcare what so many industries have gone through, and the next 10 years are really pretty exciting.
Great, looking forward to it. Tim.
I'm probably just going to echo a lot of what's been said already. I mean, the market that we're in, there is a global skills shortage of therapists. In Europe, there's 15 therapists per 100,000 of the population. In the US, 30, but not evenly distributed. And so, and just look across the number of open vacancies there are across the NHS in almost every area. So I think the skills shortage and the growing demand, and also the growing shift in demographics, is going to be a forcing function, and a positive one for early intervention, for prevention, and then also for personalization. Essentially, I think there's a great opportunity for digital tech to be alongside people for life, nudging at times, supporting them, supporting you and your family as part of that. So I think it is an incredibly optimistic future, but I think there's one thing that's going to need to happen to make sure we get there safely, which is more regulation actually rather than less when it comes to efficacy, right? So that we make sure there's a high bar that we all pass through to ensure that we're providing safety at scale.
Interesting. Yeah, safety at scale, absolutely. Hugo.
What I think the world is going to look like, you're still going to have healthcare systems that will still largely be national or state-based, but in markets like the United States, they'll be also driven by large payers. I think you will see under those systems, you'll see a pool of therapists that will either work collectively or as individuals that will be digitally capable and very comfortable working with a wide variety of digital tools. There will be digital therapeutics. So that will be a layer that does some of the work that some therapists currently do. But there'll be digital technologies that are actually providing care or processing data in such a way as to kind of help with diagnosis or management or flow. And then there will be infrastructure technologies that actually support all of them. And those infrastructure technologies will actually enable interconnectivity of those systems. And I think what we'll start seeing over the next few years is working out which various companies currently play in different areas, and various government solutions play in different areas. But certainly as a company, what we've seen is that we've had to become more and more focused on just one. And you'll see some companies become more and more focused on providing digital therapies. There'll be more and more companies that focus on providing digital therapists, but leveraging other people's technologies in order to be nimble in that environment, and healthcare systems that will pull levers across all of those.
Sure, sure. We've only got a couple of minutes left. So the final question that I'd like to ask each of you to answer as quickly and speedily and concisely as possible is, what do you see as the real future margins in digital health? Where is the money to be made? Beju.
Well, the money in healthcare is all downstream. It's in hospitals, it's in drugs. So as you digitize those things, it's how you remove the spend in hospitals, or how you remove the spend in unnecessary medication into the community or into primary care. But that's a shift of spend. The new spend will come in digital therapeutics, in my opinion. And we'll see how that pans out over the next few years. It's going to need a lot of data, but ultimately it's about moving the spend that's unnecessary downstream. Great.
Charlie.
I'd say it's exactly that. It's basically, can you as a digital provider capture those cost savings? And that's really where the money will be made. And the way you'll do that is by keeping people healthy and keeping them out of hospital. It's actually pretty simple of how to do it, but actually doing it is quite difficult.
That's a great get out of jail free card. Tim.
Yeah, I mean, that future is a great one. We'll all sign up to. Is there's quite a lot of headwind about making that kind of change to value-based care. Look, I might answer it in a more plain way. When you're looking, organizations are looking at organizations like ours that are grouped in the kind of SaaS healthcare, we're a SaaS business model, subscription-based business model. we're not going to be comparable, because we are a blend of people plus tech. We're not going to be comparable to a 90% margin service from a pure software service. But I think if you look at our peers and ourselves, we're at the sort of 60-ish, and we think we can probably get that up as we start to apply AI to augment and support our practitioners and help to do triage faster to get people the right kind of support. I think you can get that up probably, 10 basis points up to 70%.
Great. Hugo, in the last minute or two.
So if I come back to the buckets of where I think the world is going to be, and this concept of stages, there's different amounts of money to be made in each of those different buckets. In the therapists and digital therapists bucket, that's going to be there's going to be always a need for therapists, and there's going to be a nice constant flow of supply and service delivery associated with that. So, throughout, that's going to be a steady deliverer. I think in the short term, the digital infrastructure upon which things lay, back to, I think it was Charlie's point, there's a cost shifting element, but that's where there's an enormous opportunity to be made, in the next few years, because that's a real laying down of road. And I think if you're prepared to play a long game, it's the digital therapeutics that will actually deliver, substantial increase in value in that sort of 5 to 20 year kind of period. So as an investor, you've just got to choose, you want to be in digital healthcare, where do you want to play? If you want to play in, I want to support providers today and provide services, well, that's that first bucket. If you want the long play, where you might have, some massive return going forward, then you go into digital therapeutics. And if you want that intermediate play, maybe it's in digital infrastructure that's providing the tools, but not the people. And you've got really choices in this market where you might want to go.
So the bottom line is there is huge opportunity. This is an absolutely growing market, and the next 5 to 10 years are going to be incredibly fast moving and interesting. Well, I'm afraid we've come to the end of the webinar. Thank you very much indeed for your fantastic insights panel, and thank you to our audience for their questions. It just remains to say, have a great rest of day, and Hugo, you can go back to bed now, as it's the middle of the night in Australia. So a huge thank you to Beju, to Charlie, to Hugo, and to Tim, and to Edison for hosting the webinar. Thank you very much.